Um, my vein issue started about a year and a half ago. After I was diagnosed with cancer, had a hysterectomy. In the process, they also took out several lymph nodes. So I began to notice that my legs were getting heavy and thick, and I just thought that was being female, fat, and over a certain F word. And then as I think about it, the process probably really began prior to the diagnosis of cancer and the surgery. But after having such thick, heavy ankles and legs, I thought, I need to get this looked at. So that's how I came to bring myself to seek out treatment with somebody who knows about the vascular system and veins. My first visit to the Vein Institute was just wonderful. It's clean, bright, beautiful facility. Staff is incredible, professional, but yet personable. You feel like you're the only person here. They take the time. You don't feel rushed. You don't feel insignificant. You're not just a number or a procedure. It's wonderful. Through the course of my time coming to seek a consult and then discovering that I was dealing with the dual issue of lymphedema, but also I had some venous insufficiencies because, again, I never thought that it would be me. I had no varicose veins. I wasn't dealing with spider veins. I just had these thick, heavy legs. Dr. Gardner sent me to the right place for physical therapy for the lymphedema. But then as soon as that was resolved and taken care of, then the rest of the swelling was addressed through having the procedures to have the greater saphenous vein removed. A little apprehensive as anybody is with the first procedure, but I actually got through both procedures with no anesthesia, and that's an attribute or a compliment to Dr. Garner's touch. And then there was no concern as to what was happening as they explained everything every step of the way. I was keenly aware, and it was wonderful. Left leg went well, so I was excited to come back and get the right leg done. Now I am 2.5, 3 weeks out. Still in the process of recovery. It takes a little bit for those to be absorbed, but I have ankles. Who knew? Who knew that this was more of a venous issue than just being female, fat, and over a certain F word? I'm excited and thrilled. I'm glad I did it. Would do it again. And had I had the insight to my own self, you're your own worst patient when you're in the medical field, I'd have done it sooner.